Hi, my name is Dr. Richard Lindell. I'm an animal chiropractor here in Keller, Texas. And we're working on Swifty here today here at Rocky Top Therapy Center. He's got a little bit of lameness in the left rear leg here. So we're going to take a look at him and see exactly what's going on and see if we can do anything to help this guy out. All right, we found a little problem with his low back here, not necessarily his pelvis or his hip, but his low back. And these are the nerves in the exit the lower part of the back here that feed into the hips and legs. It can cause lameness, it can cause difficulty collecting. He's a kind of an older horse, so and they don't use him a whole lot, but we want to make sure he's feeling well, so that in case they do need to use him here, he's good to go. And just doing a little bit of motion palpation to see what joints are moving, which ones are stuck, and when the bones get out of place, it causes pinched nerves. So we call it subluxation in chiropractic, and it can affect all the organs and tissues of the body as well as the muscles and joints. And we've got to put a little bit of motion right back in this joint here. Good. There we go. And then recheck, make sure that bone's moving again. Sometimes the effects are immediate, sometimes it takes a couple days for it to take the full effect, but he's been like this for how long, Brooke?
2 weeks.
For about 2 weeks. The vets come out and check to make sure there's nothing else that he needs to be doing and get him moving a little bit better. Horses generally, as a rule, they like chiropractic. They like when I work on them, helps them relax, helps them feel a little bit better. And they don't run away from me like they do when the vets come to inoculate. Good. There's no previous injury to the horse that they know of, but it seems like he's got a lot of stuff going on, a lot of muscle tension in this left side. Still pretty sore. Nobody rides him, correct? But he's got quite a bit of discomfort here on this left side. I'm going to check the ribs here too. Good. Do you know when the last time it was he was ridden or even saddled?
They typically don't saddle on the right trail program.
Okay.
It would have been before he came here.
Okay. See, when I'm pushing as hard as I can on this right side, and it's not eliciting any pain response. When I push the left side just a few minutes ago, it was creating quite a bit of pain response on the left side there. And even now, just within 2 minutes of being adjusted, I'm putting as much pressure as I can right in that same spot, and it's not nearly as tender as it was. So that's a good indication we make it a good correction there. The middle part of the back of most of these horses, they don't move a whole lot because they got so much soft tissue, and the ribs here help protect the thoracic area from moving. But right up here in the withers can have some problems. Either he really likes that or he's just getting bored.
I think he likes that.
Yeah. Good. I'm going to do a little bit of correction right here on the withers with a pull move. Good. Yeah, a lot of times it gets their attention here as well too. Most people think when they look at a horse's neck bones, usually they associate the bones of the neck up in this part here like it is on humans in the backside, but it's not. Horses' bones are on the front right here, this big thick portion right here. There's hills and valleys here. You can feel in between the vertebra. There's a big, what they call a nuchal ligament, that runs all the way from here to here. It's what helps hold the horse's head up. So we're going to check his neck out here, see if there's anything going on that we can work on here. Brooke, if you don't mind moving the little stool. We're going to check his range of motion of his cervical area here, see if he can turn his head all the way. He's just really reluctant. He's an older horse. How old would you say he is?
He's 28, 29.
He's pushing 28, 29 years old. Good. Good. He's a good gentle horse, that's for sure. There you go. A lot of cracking and popping as he moves. You hear all that? What we call crepitus. And that's okay. We're just going to check to make sure we get some good movement in the spine here. Good. You like that, don't you, buddy? Good. Okay. He's a little reluctant to turn all the way to the right here. A lot of times how you can tell a horse doesn't may have a problem with the joints in the neck is when they lean their head to the side like this, they have skin folds. I'm going to come around this way so I can kind of show you here. They have skin folds right here, And you notice whenever we get him turned quite a bit here, the skin folds stop right there, and he's going to want to try to swing around. It's because when that joint gets locked out there, it's stuck, it's out of place, and he's basically just telling me, his body's telling me, hey, that's not how it should be, I want to try to turn. So we're going to see if we can do a little bit of work right there on this bone here, see if we can get a little bit of motion. Good. A lot of times after we adjust the horse, we get done with them, they'll start chewing, they'll start lowering their head, they'll get real relaxed and calm. Always after an adjustment, we check range of motion. May need a little bit more correction on this side here. He might want to turn. There we go, good adjustment there, buddy. Chew it out. I don't think he knows what to do with that one today. He's never been adjusted before. I've never worked on him. Is he a newer horse to you guys?
No.
No? Okay. We'll take a look here. All right, if you would hold him real quick. I'm going to check his atlas area. The pole up here. Check and see if there's a misalignment. This is the very most important bone in a horse's body as well as ours. It affects everything else down below. If it's twisted or if it's tilted, it can cause a lot of problems. He seems to be doing pretty well up here. Good. All right. Right here over the L6 and L5 vertebra was quite a bit of tenderness a few minutes ago. It's a little tender still. There's some swelling in here. So what we'll do is we'll make sure they don't do a whole lot of work with them the next couple days. They'll just give them some rest, and if I need to, I'll come back out next week and take another look at him. See how he's doing. It still seems to be this left side. We elicit a pain response with just about 2 or 3 pounds of pressure here. On the right side, I'm putting about 15 or 20, and there's no pain response whatsoever. Usually a good indication that there's something going on in the lower part of the back. Sometimes you'll see people run their fingers or their knuckles down the back of the horse's spine and they'll dip. That's a natural reflex that we have, so that's not necessarily an indication that there's sore muscles or that they've overworked them. Usually if there's palpable heat, tenderness, swelling, that's usually an indication that the bones are out of place and causing a problem.